everybody. Good morning. I am your classmate Ryan Mohammed Zain, and my today's presentation topic is the spongy organ. I'll be talking about the human lung. I will define and discuss its components, its structure and function. I will also explain how can this information benefit us, how can we make use of it, and I will also be talking about a little bit about smoking, and I will conclude my presentation. So to define the lungs, it's a pair of organs inside your chest that is responsible for supplying oxygen and getting rid of carbon dioxide, which is CO2. And as for moving on with the structure and function of the lung, anatomy and physiology, which is a fancy way of saying structure and function. We have the lungs, of course. We have these components, but at the moment, we were just going to talk about the bronchi. The bronchi is a tree branch shaped like air passages that when air gets into your lungs, it's by that channel. And at the end of each bronchi, bronchus for a single, bronchi for plural, and at the tip of each bronchus there is a air sac called an alveoli. It's a balloon-shaped air sac filled with blood vessels. It is responsible for the exchange of oxygen and carbon dioxide. And it's balloon-shaped, and there are millions of it in your lungs, which increases the surface area for breathing to the equivalent of a tennis court. So that's a lot. In chemistry, the more surface area you have, the more reactions will occur. Well, in our case, the more surface area for breathing, the more oxygen the lung will be able to supply to our body, which is good. And we have another component, which is a diaphragm, and it's not particularly part of the lungs, but it is an essential part responsible for the inhaling and exhaling motion of breathing. And the diaphragm is a muscle when it, of course, if you know muscle, it contracts and it relaxes. When it contracts, it spreads through your chest, thus letting more air to your lungs, expanding your chest cavity. As we can see in this illustration, it contracts now it's relaxed, shrinking your chest cavity. Now it's inhaling, getting air to your lungs. Now it's exhaling, relaxing. Now, why am I saying this? I'll be explaining how can we make use of this information. Well, in pathology and diseases, we have to know what is normal so we can know what is the abnormal. And then we come to the stage to treat it. So how does knowing these principles about any organ, specifically the lungs, how can it benefit us? Well, as we took an example in nursing too, yesterday in fact, we learned how the eye works, and that led to the inventions like eyeglasses. And how can this benefit us in our lungs? Well, it helped doctors in the 1920s, in specifically the poliovirus era. This iron lung machine helps patients who suffered from poliovirus, make them easier to breathe. But as you can see, this machine has many cons. First, it restricted the patient's movement. He can't move freely. It obstructed healthcare professionals to monitor the patient, to measure his heartbeat, whether to measure his blood pressure. And that led to the invention of ventilators, as you know, from the 1960s until now. What can benefit us also is to discover diseases, to discover the abnormals once we discovered the normal. So now we get to the pathology side. One of the most famous diseases of the lung that can affect the lung is asthma, which is an inflammation in the airways, which makes it harder for the patient to breathe. As I can see, increasing of mucus and tightness in your airways. Another famous disease is pneumonia, which is a bacterium disease that can be caused by bacteria from the air or can be infected, in fact. And these are the most famous. There are a lot of lung diseases, but I focused on these two simply. And now it becomes to the stage of treating these illnesses after we know what is the abnormal. As for asthma, we haven't found a treat yet, but we have found something that controls the symptoms. You may know it. What is it? Inhalers. Correct. Excellent. Inhalers. It controls the symptoms. Unfortunately, not to treat it completely. For pneumonia, I'll let you guess that too. It's a bacteria-caused disease, so what is the optimal way? Yes, antibiotics. Excellent. Antibiotics. And that's how can we benefit from principles and knowing what's the abnormal. We can study its structure, we can study it so we can discover what is the solution for a certain problem. Well, I'm going to talk about smoking. What are the most famous smoking diseases that you can think of right now? Lung cancer, yeah, excellent. Although smoking can cause lung cancer, but it's not necessarily that. What smoking does to your lungs, really, it just decreases the lung function for it. Decreases your lung function, thus making you susceptible to these illnesses, lung cancer being one of it. And studies have shown that a long-term smoker at age 40 cannot enjoy a deep breath. He can't do that, depending on researches. So, yeah. In conclusion, I want to conclude my presentation with appreciating our organs, that it does the hard work for us. It takes care of us after Allah subhanahu wa ta'ala. So we shouldn't hurt them by bad habits like smoking or secondhand smoking, not necessarily smoking, and doing more good habits like exercising, eating more healthy, and also to apply knowledge and developing instruments and discovering treatments for other diseases in our field. And I would like to end this with a quote: "Our organs take care of us, so let us do the same." I'm Rayan Zain. Thank you.